Hi, I'm Kelly Welch, Executive Director and Health Educator for Team Maureen. Team Maureen's a nonprofit on Cape Cod that started in 2007 when we lost Maureen to cervical cancer. Since then, we've been working to end cervical cancer by educating about the connection between HPV and cancer and the importance of prevention and early detection. Because educating about HPV is our mission, let's start with the basics, like what HPV even stands for. HPV is short for human papillomavirus. It's a virus that can cause warts and 6 types of cancer. It's sexually transmitted and spreads by skin-to-skin contact. You've likely heard of other sexually transmitted infections, like maybe gonorrhea, herpes, or HIV, but you may not know much about HPV or have any idea how common it is. Gonorrhea has around 270,000 cases in the U.S., and HIV has just under 1 million. But HPV is so much more common than these well-known STIs that you could add up all the other types of diseases on this chart and still not have as many cases as the nearly 80 million cases of HPV in the U.S. 80 million infections works out to about 4 in every 5 people in the U.S. having an HPV infection at some point in their lifetime. HPV is a bit different than other sexually transmitted infections, in part because of how it spreads. Any type of intimate sexual contact, genital touching, or rubbing can spread HPV. Intercourse is not necessary. The most common way of spreading HPV, though, is contact that's genital to genital, anus to genital, mouth to genital, or hands to genital. And spreading this way means that a condom doesn't offer complete disease protection because there's still a lot of skin that can touch other skin. So, if you're exposed to HPV, how will you know you have it? You very likely won't know at all. Most people who have HPV don't have any symptoms, and the immune system just fights it off. This is good and bad. Good because it doesn't cause symptoms or health problems, but bad because without knowing you have HPV, you could easily and unintentionally infect others. Now you might wonder, if there are no symptoms, why do we even care about HPV? The answer is because of cancer and warts. HPV causes 6 types of cancer: cervical, oral, penile, vaginal, vulval, and anal. And it causes warts in these same places. So let's take a look at some of the lesser known anatomy because you likely already know where the penis and anus are. In people born female, HPV can affect the vagina, vulva, and cervix. The vagina is also known as the birth canal because babies are born through it, and the cervix is between the vagina and the uterus, where a baby would grow. HPV can also affect the anus and oropharynx in people born male or female. In fact, the most common cancer caused by HPV is oropharyngeal cancer. Look at where oropharyngeal cancer happens on this diagram. The oropharynx is at the very back of the mouth. It includes the tonsils, base of the tongue, and throat. You can imagine that cancer in this area can make it hard to talk and eat, and the treatment is very difficult. For men, oropharyngeal cancer is the most common type of HPV-related cancer. It's the green on the graph, far more than penile and anal cancers. But for women, cervical cancer is the most common cancer. It's the section in red. Almost all cervical cancer is caused by HPV, and oropharyngeal cancer has increased over 200% in the last 30 years. But having HPV doesn't mean you'll have cancer. Only a persistent infection that stays around a long time can cause cancer. HPV can cause cells to change from normal to hyperplasia to dysplasia and then to cancer. And that takes time, like 10 or more years. And usually the body's immune system can fight off an HPV infection in just a few years. And thank goodness for the immune system, because there's no treatment for HPV infections. It's a virus, which means you can't take antibiotics to treat it. And there are no other medications for HPV infections. But thankfully, there is a vaccine to prevent HPV altogether. We have had a vaccine for HPV since 2006. It started as protecting against 2 types of HPV, then 4 types, and now 9. The Gardasil vaccine, the only one you can get in the US today, protects against 7 types of HPV that cause cancer and 2 types that cause almost all genital warts. But what is a vaccine and how does it even work? Let's take a look at this video from HPV Info Canada.
Let's start at the beginning, because this is not an easy topic to understand. The human body has been constructed in such a way that when a germ or virus gets into your body, the body knows that it has to kill it to stop you from getting sick. When the virus is in your body, it sends out a special signal. The body receives the signal and understands that it has to make enough immunity destroy the virus before it begins to make you sick. Most people don't know this, but every time your body meets a virus, it remembers that virus and knows how to fight it if it ever comes back. The body, however, is not always fast enough or strong enough to make immunity in the amounts you need at the time that you need it. And so, you sometimes end up getting sick. This goes for any virus. Think of HPV as a candy that has been covered with a bright pink shell. The vaccine injects the pink shell into the body and tricks the body into thinking that this is the virus. Since there is no candy inside the wrapper, no real virus is introduced into the body. Once tricked, the body starts making immunity to kill the pink shells and remembers that it has created protection against this virus. So if you ever get the real virus from somebody who is infected, your body will recognize the infection and start destroying it right away. Since the vaccine does not contain the virus, you cannot get the HPV infection from getting the vaccine itself. You can only get it from someone who is infected.
So one important takeaway is that you can't get HPV or cancer from the vaccine. But how well does the vaccine even work? Our best data on effectiveness of the HPV vaccine comes from Australia because they have required vaccination in schools for over a decade. After vaccinating 70% of girls for 4 years, Australia saw a near disappearance of genital warts, and they weren't even vaccinating boys yet. Now, Australia is vaccinating all boys and girls, and studies show that they are on track to completely eliminate cervical cancer by the year 2028. Vaccination here in the U.S. is recommended by the American Academy of Pediatrics and the American Cancer Society. Everyone should be vaccinated, regardless of gender identity or sexual orientation, because HPV does not discriminate. Regular vaccination requires 2 doses at age 11 or 12, though you can get it as early as age 9. Any time after age 15 is considered a catch-up vaccination and requires an extra dose of the vaccine to be effective. In 2019, there was a new approval that the vaccine could be given to people up to age 45 if recommended by their doctor. However, the vaccine is not nearly as effective as you get older. Think about the flu vaccine. You can't get vaccinated against the flu after you're already sick. You have to be vaccinated before you are exposed to the flu. The same is true for HPV. By age 45, many people have already been exposed to HPV, so the vaccine isn't as effective. The HPV vaccine is one of the most studied in history, with multiple ways that its effectiveness and safety are tracked and measured in countries across the globe. There have been 270 million doses given worldwide and 100 million doses in the US, with no serious health concerns identified. Yeah, it hurts because it's a shot, but that's about it. In addition to vaccination, we also have screenings for some HPV-related cancers. A Pap test that looks at cervical cells under a microscope can detect changes on the cervix before they even become cancer. Everyone born female should have a Pap test or an HPV test regularly. And everyone should see a dentist regularly for a cancer screening where they examine your mouth and feel your neck for unusual lumps. So let's sum it all up. Almost everyone will have HPV in their lifetime. It spreads by intimate skin-to-skin contact, and if it persists, it can cause warts or cancer. The HPV vaccine is safe and effective and recommended for everyone ages 11 and 12. You can decrease your risk by getting vaccinated, avoiding intimate contact, and seeing your doctor and dentist regularly. Hopefully you've learned a bit about HPV and how to reduce your risk. And if you already got the HPV vaccine, maybe now you understand why. Remember that visiting your doctor and dentist each year and having honest conversations about your health are key to staying healthy. If you have any unanswered questions about HPV, you can always email us at info@teammaureen.org or visit our website. And thank you for joining us.